You give that diagnosis and then you're given nothing to go off in terms of helping with that. And it can be very tricky and very individualized for everybody in terms of what the treatment might be or how you can actually resolve the symptoms. And so even getting that, you're still left with a lot of questions. And naturally, if you're being bombarded with information every day, you're going to find some answers online, whether they're right or whether they're wrong, for sure.
Autoimmune diseases might be one of the worst online rabbit holes in that from the very beginning, a lot of these issues present in very confusing ways or in some somewhat vague ways that don't directly point to one condition, so that can lead to a lot of searching online. And then a lot of people do prey on this group specifically, selling like some type of cure or treatment or protocol or plan.
Sometimes I feel like a bit of a party pooper when I'm telling somebody like, okay, maybe this is not necessarily needed. But it's good that they always let me know, right? Because then we can.
All right. Well, welcome back to another episode of A Plate Full of Insights. Today we are going to be talking about I think it's a hot topic. It's a topic that whether we're seeing clients, whether we're just even in the dietitian world amongst professionals, of really navigating health advice and how difficult it is, especially with the uptake of the wellness industry, social media, a lot of platforms, a lot of voices having a lot of opinions on a lot of things that cross over into the nutrition world. And I am joined today by two awesome registered dietitians who we're going to talk about this and how it's difficult and how do we even navigate that. So we're going to take a moment and introduce ourselves here. And I can start. I am Andrea Shackle. I am registered dietitian and clinical lead here at Revive Wellness.
Yes, I'm Laura. I am one of the registered dietitians on the team here at Revive Wellness as well. And yeah, excited to be here.
Same for me. I'm Matthew, one of the registered dietitians on our team, and I'm looking forward to this episode and sharing some information on just ways that people can look out for some of these red flags when it comes to nutrition misinformation online.
Okay, right on. Well, let's get going into this because we know that it's a thing. We know that with social media, it is becoming an issue. We've got, the terms of influencers now. But yeah, how do you guys think that this is causing part of the nutrition misinformation? Like, yeah, let's start with how you guys feel about how this is ending up that we need to talk about it.
Yeah, I think the key, just top level thing here is that with it being more easy than ever to share information online, whether that be through podcasting, YouTube videos, Twitter, Instagram, anywhere, essentially anyone can share any type of information. There's a very low barrier to it, which has a lot of positives as well as a lot of negatives. It is a good thing that it's easier to communicate with many others that in the past you wouldn't have been able to. You can reach a global audience, a provincial audience, rather than just those that are more close. But this also comes with the downsides of anyone can share anything without any type of verification, any type of further validation, and just share, essentially anything they would like.
Yeah. And on top of that, algorithms on social media are such a real thing. So something could catch your eye. It could be very enticing and spark a lot of new thoughts for you. But I've had it so many times before where I spend like 2 seconds on a post that I don't really want to even entertain. And then the next 5 posts are the exact same topic. So it's really something that like you can fall into a bit of a rabbit hole very easily. And that can be a really good thing sometimes if it's accurate information or helpful information. But yeah, it can often lead us down a path where we're getting a little bit of bad advice or maybe some red flags there as well.
Not just bad advice, but also things like trying to take advantage of things like fear and anxiety as it relates to health, which can also just lead down a very not a good path.
Okay. All right. So a lot of information is getting out. I mean, even for us here, right? We're trying to get information out amongst also information that might not be correct information. Um, so what is the harm? Maybe we need to even start having that conversation. I don't even know if people see it as a concern or why we would be concerned. So maybe we even need to talk about that. Yeah, what is the harm and what are we finding that we're so worried about?
Yeah, I think it could be maybe a difference between, sharing your opinion, sharing like values and your personality out on social media, things like that, versus sharing advice where like we are giving out health advice, for example, where like there could be real life consequences to following some advice that maybe was incorrect, and can actually affect your health in that sense. So, if you like, for example, the thing that I see out there a lot is people maybe giving diagnostic criteria for certain conditions, or kind of like over um guessing is like, if you demonstrate this symptom, then you definitely have this disease, or like you need to treat it this way, when we don't even necessarily know if that's the case. And there's a lot more history that's involved and expertise involved in trying to figure stuff like that out, that you should visit kind of your primary care physician to get checked out at least. Things like that, where it leads into the health side of things that can have some bad sort of outcomes in that sense.
Yeah, there are, like Laura said, different areas where this can be an issue in all steps along the way in treating a medical condition. So this can start with, if we just go in chronological order here, the assessment of a medical condition. Rather than maybe seeing a doctor about that, people are maybe looking at online forums or just Googling symptoms to try to see if they can use that to come to a diagnosis or a suspected diagnosis. Once that is in there, someone may like it's like, I think it's okay to suspect maybe something is going along a certain path, and this might be something to talk to a healthcare professional about. But some people may take that a step further as thinking, I definitely have this thing that I read about. And then that again is intertwined with that fear aspect, which can be an issue. And then going after the diagnosis, an incorrect diagnosis, whether it is from a healthcare provider or from something we suspect or see online, that can then lead to some kind of intervention for that diagnosis that is either not treating the right thing, not treating it effectively, and essentially it becomes a rabbit hole where in all steps along the way this can be a problem when we're assessing an issue, when we are diagnosing an issue, and when we're trying to think of what an appropriate treatment is for that issue. There can be a lot of rabbit holes online that we can fall down that interfere with all of that.
Okay. So many different things that people might be reaching out to look for social media. And then, yeah, could lead down the wrong path depending on what they see, or go down the rabbit hole of that one thing leading multiple things. Um, are there people that you work with or populations that you work with who are more susceptible to getting caught in this, or being kind of basically preyed on sometimes, actually? So do you have kind of populations that might be more at risk for this?
Yes, I think that applies to both myself and Laura. So I'll start with that. I work with people in the areas of allergies and autoimmune diseases. And autoimmune diseases might be one of the worst online rabbit holes in that, just from a from the very beginning, a lot of these issues present in very confusing ways or in some somewhat vague ways that don't directly point to one condition. So that can lead to a lot of searching online. And then a lot of people do prey on this group specifically, selling like some type of cure or treatment or protocol or plan to treat either autoimmune diseases generally, just very vaguely, like an autoimmune protocol, which different there are different autoimmune diseases that are treated different ways, so there isn't really a one size fits all kind of thing. So people are targeted in that way. It's a lot of people with autoimmune diseases take a long time to get diagnosed because, again, these things do not present in a very specific, traditional way that you automatically suspect one thing. So, this can lead to a lot of searching and just a lot of frustration with their own providers or with the medical system more generally. And this makes it a very, um, in the eyes of those that are more predatory, a very good or easy group to target. And yeah, it's a very big issue that I've seen for sure in some of the areas that I work in.
Yeah, I feel like there's a little bit of overlap too in sort of like the autoimmune and allergies sort of side of things. I work with people dealing with some gut health issues, and sometimes that can mean irritable bowel syndrome. And so I find a lot of the times people are coming in suspecting allergies or suspecting specific food intolerances. Um, a lot of the times, that's where I hear from social media they've heard like gluten is bad for this, or I can't eat dairy because of this, but they've never actually been like physically assessed for maybe an allergy. There's the kind of whole rabbit hole we can go down with how food intolerance tests maybe aren't actually giving you the information that you are looking for that. It's not really a um, valid test in that sense for defining that. So there's definitely some overlap there, but the kind of thing there that I like to mention is it's fair that people are looking for answers from social media because there's just like not many answers out there, I find, from the typical path you go through your primary care physician, especially for irritable bowel syndrome. It's one of those things that's diagnosed sort of after you exclude everything else. And then the kind of impression that I get from a lot of my clients is you give that diagnosis and then you're given nothing to go off in terms of helping with that. And it can be very tricky and very individualized for everybody in terms of what the treatment might be or how you can actually resolve the symptoms. And so, even getting that, you're still left with a lot of questions. And naturally, if you're being bombarded with information every day, you're going to find some answers online, whether they're right or whether they're wrong, for sure.
In my area with my clients, definitely for people living with obesity, diabetes, chronic disease, those are other people who, they are looking for answers. And I know, as a healthcare provider myself, there's done a lot of evidence and done a lot of research, and sometimes the answers that we give aren't always, black and white. They're not always a yes, if you do this, X will happen. And it's hard to do that, because we're held to that of, what, this is the evidence we have at this moment in time. Um, but for people who are living with health conditions of any kind, that might not be what they need. They are looking for something that's, more concrete, more just do this. And that makes everybody a little bit more vulnerable then, because, and what I kind of wanted to move into was, how do we spot these red flags? Because one of the first one my clients go to is like, what is the cure? And then just typing something like that in all of a sudden starts that potential rabbit hole of a lot of misinformation. So why don't we go there? What would you say are some, for our listeners out there, what are some common kind of what we would call red flags? Like, what would be things we should, that would prompt that, like, hey, I need to just take a moment here?
I would say the main one that I just find is probably a common ground for everything is just making those kind of like extreme claims in the sense that, like, yes, this will definitely fix all of your problems. Like, I know the cure or I know the treatment, without really considering the individual person. And that's like just byproduct of social media. You don't have that one-on-one interaction. You're expanding this recommendation to like essentially an infinite group of people. So in that sense, like there's no way we can possibly say that this is going to work for everybody. But those algorithms, they do make it feel targeted to you for sure. So I can see how it feels like this could be something that would be a good path to go down, but always kind of just take a beat when you hear any sort of advice that says it's for sure going to fix your symptoms, and just do a little bit more digging, bring it to maybe a qualified health professional in the field, to ask a little bit further questions about it.
Yeah, in a more formal medical or health context, a healthcare provider is generally not going to speak in such absolutes in saying that this one weird thing or this one specific thing is going to 100% fix all of your issues. It is unfortunately a lot of times more of like a trial and error kind of thing where we will try this type of treatment. We will evaluate or assess if it's working. If not, there are these next steps that we can go through, and it unfortunately can be a longer term process. But the thing is that we're going through different evidence based approaches to work on something, and it might not work at first. It might take two different things, three, could be more. And if someone is promising 100% effectiveness, 100% everything, then that's a massive red flag. Yeah.
The money back guaranteed kind of claims. Okay. What are some other ones? What about there's even talk of, as social creatures, we like to know what other people are doing. We seek out kind of that, hey, what are you doing about this? Or, somebody who's living with this or was diagnosed with this. But we also know that stories or personal shared experiences can also be a red flag. So do you guys want to talk about that? Because it's an interesting one, I find.
Yeah, I think it's comparing and contrasting those personal, like, success stories that can be very inspirational and have, like, a lot of emotions tied to it, versus actual, like, evidence where we're proving that something has worked in many people, over a longer period of time, things like that. That's what I find in a lot of marketing for these, like, health products or sort of natural supplement products is we're using more personal anecdotes and stories to confirm, like, yeah, this worked for me, it was amazing, like, no side effects, no nothing, it was perfect and all my problems are fixed now. And that sounds very, very good, and it can get you really excited, and they can look very legitimate, right? But there's always that risk that they might have been paid for giving that review, or they might have been sort of like indirectly coerced into giving that positive review, because it benefits them in another way, even if they perhaps meant well or enjoyed the product. It could still be a little bit misled in that sense. So always kind of like keeping your eye out for that. Is this mainly personal stories, or is there some actual evidence to back it up? And where can I find that evidence? Do they make it easy to find, or do they actually put it on their website if it's a product that you're looking at, to keep it kind of like open and honest in that sense?
Yeah, and on the personal stories and anecdote type of thing, this isn't always done in a way that is predatory. Like some of what you were alluding to, Laura, in terms of maybe like selling it alongside a product and saying this has helped all of my customers, that kind of thing often is more of a direct scam. But there are some people where it is more of like maybe an online community or forum that's dedicated to a specific condition, and it's people sharing their own personal stories that they say like this helped me, and they either it legitimately did for that specific person, or sometimes it's more of like a during that like if you have a more complex medical condition, you probably tried several different things along the way, and it may have some point gotten better, and at times it can be hard to directly say that this one thing was what made it all better. It could be a combination of things. It can be sometimes the nature of the condition changing over time. So these aren't always, these like more personal anecdote types of things aren't always intentionally misleading, but some people, just due to their own experience and their own excitement and wanting to help others who faced a similar thing that they can empathize with, just with the same firsthand experience, that can also lead to these misleading personal stories unintentionally.
have such a good example that is just in my brain now that I mentioned before. For that is what I get kind of bombarded a lot with for some reason is kind of like the recipes sharing side of things, or like the diets that people might recommend. And a lot of that does seem like, oh, this worked for me and I like really enjoyed it. I found a lot of good benefits from it. You should try this too. Or maybe they won't even say you should try this too, but because that review has been so positive, or they've had that experience, it can be very enticing to try. The one that I was bombarded with for like a couple months at a time was carrots, like raw carrots to balance your hormones. So eating raw carrots with a little bit of salad dressing, essentially just a carrot salad, was going to fix all of your hormone problems. If you even had hormone problems in the first place, who knows? But it was kind of just through like making those videos about the carrot salad or whatever, the person looked like they were living quite the ideal life. They made it very aesthetic and things like that. So we can always make those sort of connections in our brain, like, oh, that looks really nice. Like they look like they live a really good life and their hormones maybe are balanced. It looks like, I don't know what that looks like, but they look good. So maybe I should try a carrot salad. So it's not necessarily harmful information. Like carrots are good for you, sure. But just that kind of like subtle misinformation that I feel like is really common nowadays for sure.
Mhm. And related to that point on hormones, I think another red flag we should touch on is general vagueness when it comes to the claims of what something can help with. So, yeah, like that's a perfect example. Like balancing your hormones. Which ones? What type of hormonal imbalance is there? Is it yeah? Is it like sex hormones in some way? Are we talking about cortisol? Are we talking about yeah, which like be more specific, what type of hormone? And with conditions like that that are legitimate, they have names. Some people may have Addison's disease, some people may have hypothyroidism, and these are things that we can be assessed for. And if we do think we have some sort of hormonal or endocrinological problem, there are people that we can see about that type of stuff. You can get blood work done for if you are worried about a specific medical condition with a specific set of symptoms and discuss that with your doctor, they can walk you through that process or discuss whether it may or may not be warranted. And then also on the vagueness and hormone side of things, there are people who use essentially made up credentials in some of these areas. So, one being like a hormone specialist um, um, who oddly don't have like endocrinologist written next to their name, which is what that would actually be. They're yeah, just using more vague terminology for the claims of what they can treat or what their own credentials or experience are is another big one.
Yeah, vagueness. And Laura, you also touched on another piece, which is a red flag, which is around that like balancing hormones, like buzzwords. Like there's buzzwords in itself can be a red flag. So hormones, natural is a really big thing right now that I'm seeing in a buzzword of like, oh, this is actually natural. Everything you're doing is not natural kind of thing. But yeah, any red flags on those, or what should we watch out for those kind of things?
Yeah, I have another kind of good example, I think, where we use these buzzwords or these specific terms that sort of gain traction and sort of just, whether it's indirect or not, prey on our insecurities a bit. Like a big one that I've heard on the topic of cortisol is cortisol face. So this is something that people have kind of brought to people's attention. Like if your face is looking puffy or bigger, or things that like in common beauty standards today maybe isn't necessarily what you're aiming for, then there must be something wrong with you. There must be something wrong with your health, or you must have too much cortisol and things like that. Where I mean, that is quite a jump if you kind of like lay it out and sort of explain it in that sense. Yeah, that's a pretty big jump to make, and maybe there might be an issue going on there, but that's definitely not something that we can just say like, oh, maybe it was just a bad picture angle or something like that. Who knows? Maybe that's just how you're face looks. It's nothing like to be ashamed of, but it's just putting that term to it, and sort of like trying to associate these physical appearances with something wrong is also feeding a poor message, right? So definitely using those terms, those specific terms, that can be very damaging to self-esteem and things like that, to sort of recruit people to whatever ideology you're sort of putting out in the world. That can be very harmful in that sense.
Yeah, just a lot of medicalizing things that are completely normal. And this also being very, very disproportionately targeted towards women because it is more, yeah, things that are normal and based in appearance, and then saying that you are inferior or there's something wrong, even with things that are normal, like your face being puffy. Like that's a pretty normal thing, especially in the mornings where we may have more fluid retention in the face. That's a very, very normal type of thing. Or yeah, things related to sleep, stuff like that. There are completely reasonable explanations for that that are not some kind of hormonal issue or some kind of thing that you are doing wrong. So yes, the medicalization of things that are fairly normal.
Yeah. Both of you actually kind of touched on this, and this is probably going to be a whole other, I think, episode actually that we're going to have, is around AI. Like a lot of this stuff now, we're not going to know whether it's real or not. Or Laura, right? Your example of like the person looking at the carrot salad like looked like, everything was all put together and figured out, so their hormones obviously must be in balance, because like look at all the pictures that they're posting, right? And now it's going to be not just a question of like the words they're using, but the images that they're using. Are they real, or are those fabricated, or whatever too? So it's definitely going to get even more difficult, um I think, as well, to kind of navigate this. Before we switch on kind of what we can do, there's a lot of like, there's a lot out there. I want to take a moment even just to hear both of you even talk about like even the selling of stuff, right? That can be a red flag. Going into more on that, like selling, that's a big industry in what my clients around obesity management, weight management, trying to sell stuff, trying to offshoot it as stop all taking all your medications and go with this because it's natural. That's a big one that I hear. Or if you take this, you're never going to have to take other, medications again. So supplements are turning into another thing. And we're even seeing what credentials like healthcare professionals we would traditionally trust also selling these. So now we've crossed into like, how do we know the red flags in this capacity?
Mhm. Yeah, usually like that I find just with the clients that I work with is the supplements side of thing. Some of these supplements may or may not be evidence based, but there's just so much on the market nowadays where like you can just walk into the pharmacy section of your grocery store and just take a look at the front of whatever supplement it is that you see, and it'll say good for this, and then you're like, oh well, I guess I should take this, and then I'll grab that other thing, I'll grab this thing, because it all sounds like things that might be beneficial to me. That may or may not be true, but what we really want to do is make something that's sustainable for you, is proven or evidence based to maybe actually have a positive effect for your specific situation. Because that's the thing that you don't really see on the front of the package is like, when is this not indicated? Like, when should I not take this? What could the side effects be? Are there any medications that I'm taking right now that might interact with this as well? Because that's a very real thing. But yeah, sometimes if you see that even advertised online, they're not going to mention like some of those contraindications or reasons why you shouldn't be taking something. Because in the end, they're trying to sell you a product rather than inform you of every reason why you shouldn't take it, kind of thing.
First to start, I'd say that yeah, selling things is not automatically bad. There are a lot of people that work in the health industry, where they may sell health services as we do, or maybe some type of health product. But the thing is that with a new, doing it legitimately is really hard. Like if you made like a company that sells vitamin D, that's like boring and oversaturated and that's not going to work. So people are drawn to doing things with more extreme claims or talking about something that's never been done before. And yeah, that's a big red flag there, I'd say. The more evidence-based type of stuff has been around for a while. It's been more tried and tested, and someone claiming to have like a brand new novel thing that no one's ever heard of and no one else wants you to hear about, that is more along the lines of where that should be more of a red flag, I'd say, compared to maybe someone who is selling things that do have more evidence, like, again, some of those more useful or more common supplements, a calcium supplement or uh, some kind of health services like that.
Yeah, very, very good points. Okay, well, so we've identified there's a lot of red flags. We've identified that there's a lot of challenges with information and the misinformation is out there. So what do we do about it? How do we become more of a savvy nutrition information understander? Those aren't even words, but like, how do we become that? um, yeah, because this is hard. This is sometimes a full-time job, like even on top of being dietitians, like this is even still is hard, like even for us to weed through it. So how do we, yeah, what could we tell our listeners to watch out for or do?
I guess that's what I would say, yeah, is it's a lot to keep up with. It's like a full-time job, right? And that's the people that are looking for nutrition information. It's not their job necessarily. They're not getting paid to keep up to date with all of that evidence and things like that. However, as registered dietitians, that is our duty to kind of keep up to date with some of that new nutrition research. If it's something that's kind of becoming more prominent and ready to be implemented, into the community, that's what we're supposed to be kind of aware of and make sure that we're providing those evidence-based recommendations. So I always try to consult with an expert in the specific field that you're looking for advice from. So, in the case of nutrition advice, that could be a registered dietitian. Um, in the case of other aspects or other scopes of practice, it could mean somebody different, right? So, in the case too, as well, like even medical doctors, chiropractors, any kind of other health practitioner or health adjacent professional, they may or may not have the correct nutrition education to be able to provide nutrition advice, even though often that is something that they do provide. So it just takes a little bit more follow up, and asking those, like the education that they have had in terms of that, to check and make sure that they're actually qualified and within their scope to provide that information.
Yeah. Another important piece to add to that is that so of course there is the aspect of, to get those credentials, there was a lot of specialized, difficult education in that particular topic, which is very important. But another thing to consider with those who do have those credentials is that when there are issues with spreading misinformation or maybe selling some sort of unproven product or providing some sort of unproven services, there are potential consequences for overstepping there. So all of us as registered professionals, if we did start doing some more kind of predatory practice or some kind of unproven supplement, our licensing board want to talk with us about that and see what's going on, and then potentially as well provide consequences for that. Whereas someone who's unlicensed, they can largely, up to a certain point, do whatever and not really face consequences for that. So, with the credential aspect, where you're not just saying that only these people know something, it's also that if they do overstep what is evidence based and they're doing that over a continuous period of time, then they can be in trouble for that.
Yeah, and I think that speaks to really around, which I think part of what we do, right? Just trying to debunk a lot of this stuff and trying to be those voices that are trying to stop this spread of information. Um, I'm a realist. I know clients are still going to try stuff because, it's still going to happen. Um, One of the things I tell my clients a lot is, okay, if they are going to try it, that we have some form of follow through, follow up, whether it's either, you know, something that's claiming to change something in a blood work perspective, okay, great. You know what? Let's then get the blood work to see what this is. Okay, let's do some form of, if it's claiming, do we feel better? Do we feel better? Like, are we sleeping better? Right? Because then if you're not doing that kind of self check-in either, it's something you can do. Should you choose to go down this path, make sure you are kind of doing those follow-ups, that you are kind of self-reflecting, that you are asking yourself those questions. Is this working or is this not? And then if, before you do anything with medications or anything, go tell your pharmacist the same thing. Hey, I'm going to do this. Like, what should I watch for? Is there contraindication? So also, no, don't be afraid to tell your providers what you're doing. A lot of people won't. They'll be too, not wanting to. But I'm a big believer of like, just tell me you're doing it and then we can, figure it out.
I feel like we're also trying to save you a little bit of money without not having to, like, you know, make you all go on all these supplements. Like, we have that interest for you in mind. Put your money where it's worth it. So yeah, it's always good to kind of disclose that too, right? Sometimes I feel like a bit of a party pooper when I'm telling somebody like, okay, maybe this is not necessarily needed. But it's good that they always let me know, right? Because then we can figure out if there's any things that are going to interact in a negative way, like medications or things like that. But in the end, that's what we're looking for, right? It's like, is this worth it to you? And we take both your opinion and just like general evidence based recommendations into mind there as well.
Yeah, right on. All right. Before we wrap up, any final thought of something you think, either a red flag, green flag, something to send our listeners food for thought for?
No. Has a lot of information, a lot of red flags. We're already given so much information.
Definitely.
Yes. And we will be also sharing a blog post that has, if you would like more information, that goes into more detail about some more green flags, especially, and as well as some more red flags. We did focus more on the more red flag and side of things and things to avoid, but that article will have some more information on resources on good signs for different articles or videos that make it more trustworthy and more evidence based that you can watch out for as well.
Yes, awesome. We will make sure to attach that as well. And of course, we'd love to hear from you. We would love to hear from, what are your experiences? What are the things that you find difficult to navigate, so we can follow up and speak to this. But thank you both for joining today for another very enlightening A Plate Full of Insights. So thank you both for coming, and stay tuned for our next episode. So everybody have a great rest of your day.